She has been a facilitator and a trainer for various health programs, particularly on maternal child health and nutrition. She served in various capacities in the local government unit, first as a City Nutrition Action Officer in Davao City, and later as a Chief of Technical Services in the Davao City Health Office, and much later was the Provincial Health Officer and Provincial Nutrition Action Officer 2 of Davao del Sur. She initiated the fresh milk supplemental feeding program, which led to the reduction of malnutrition among 0 to 6 years old children. In August 2019, she was appointed as the Executive Director of the National Nutrition Council, or known as NNC. She is currently designated as the Scaling Up Nutrition Philippines government focal point or person, and most recently appointed as a member of the Executive Committee of the Global Scaling Up Nutrition, known as SUN, movement representing Asia and Papua New Guinea. Without further ado, ladies and gentlemen, please welcome our third distinguished panelist, Dr. Azucena M. Dayanghirang, to give us the status update of the Philippine Plan of Action for Nutrition with focus on children under 5.
Thank you very much. Good day to everyone. I would like to extend my congratulations and deepest gratitude to Vitamin Angels for successfully organizing its second Program Partners Conference and inviting me as resource speaker. I would also like to thank each and every one of you for being here with us today. On behalf of the National Nutrition Council, I am very pleased to share with you my presentation on the status of the Philippine Plan of Action for Nutrition, or PPAN, interventions for under 5 children. Without much further ado, let me begin my presentation. According to the 2019 report from UNICEF, the state of the children's malnutrition in the 21st century can be summed up like this. More children and young people are surviving, but far too few are thriving. They are not thriving in the crucial first 1,000 days when the foundations for healthy, lifelong physical growth and mental development are laid. And they are not thriving at other crucial development stages of life across childhood and into adolescence. In the Philippines, there is progress in the nutritional status of under 5 Filipino children. And this is because the LGUs as well as the NGAs have done tremendous work in supporting various nutrition programs. However, we cannot remove the fact that the country continues to suffer from various forms of malnutrition, that is stunting, wasting, overweight, underweight, and micronutrient deficiencies. This slide shows the trends in the prevalence of malnutrition among children under 5 years old from 1989 to 2019. Despite the economic growth and increase in health budget, little progress has been made in reducing the malnutrition rates in the last 3 decades in the country. Child stunting, which is considered as one of the most significant impediments to human development, decreased from a high of 45.5% to medium 28.8% public health significance based on the WHO cutoff points. Nearly one in three Filipino children under 5 years old is stunted or too short for their age. We Filipinos are second shortest in the ASEAN region. The country ranks 9th on the global burden of stunting and 10th on the global burden of wasting. Kasama tayo sa top 10. Yun nga lang sa ngayon among the worst. Now, if this situation will continue, or will persist, the Philippines becomes more and more vulnerable to the pandemic. Poor nutrition of our people is a barrier to building resilience. The consequences of malnutrition lower the quality of our country's human capital and development prospects. Even before this COVID-19 pandemic, the Philippines is already struggling with various forms of both under and overnutrition and food insecurity. The prevalence indicated in the slide are again based on the NNS. Actually, this has been discussed fairly well by my previous speaker, our previous speaker, Dr. Abdepa. So during the pandemic, hunger has doubled based on the Social Weather Station survey in May 2020. And prolonged hunger and food insecurity will lead to malnutrition and even death. Now, the Philippine Plan of Action for Nutrition, or PPAN, 2017 to 2022, serves as our best weapon to fight our common enemy, which is hunger and malnutrition. PPAN acts as the country's blueprint of actions for nutrition improvement, led by the National Nutrition Council, together with key national and local stakeholders. Even with the occurrence of this pandemic, NNC continues to implement and monitor the PPAN to achieve the desired major outcomes of reduced stunting, reduced wasting among young children, and micronutrient deficiencies, and manage the emerging problem of overweight and obesity. PPAN is guided by 5 strategic thrusts. First, we focus on the first 1,000 days, which refers to the period from pregnancy up to first 2 years of life. This is the period when health and nutritional care is optimum, because this is the period when the body needs such the most. Actually, if we miss this period, all shortfalls in physical and mental development cannot be recovered. Second, complementation of both nutrition-specific and nutrition-sensitive interventions to address the immediate causes of malnutrition as well as its underlying basic causes. Third, intensified mobilization of local government units, particularly on provinces with high levels of child stunting, teenage pregnancy, and poverty incidence and magnitude, to ensure that PPAN programs are implemented and actively reduce malnutrition to targeted levels. Fourth, reaching geographically isolated and depressed areas, communities of indigenous peoples, and the urban poor, especially those in resettlement areas where malnutrition has been shown to be higher and should not be left behind. And fifth, complementations of actions of national and local governments to ensure achievement of desired outcomes. The PPAN features 8 nutrition-specific programs devised to address the immediate causes of malnutrition, specifically inadequate food and poor nutrient quality, poor maternal and child caring practices. These will be complemented by nutrition-sensitive programs already existing in developmental programs that can be tweaked to produce nutritional outcomes. There are also enabling programs and interventions that will help ensure efficient and effective delivery of the nutrition programs. Programs under the PPAN 2017 to 2022 aim to reach 90% of the target population, and the ambitious target is to reduce stunting from 33.4% actually to 28%. In the next set of slides, we will focus on the 4 nutrition-specific programs that directly target children under 5 years old. Dietary supplementation refers to the provision of nutritious food to targeted individuals to prevent deterioration of nutritional status and increase in morbidity and mortality. The most at-risk groups include children 6 months to under 5 years of age, pregnant and lactating women, and the medically ill. Dietary supplementation of preschool children in daycare centers or child development centers and of school-age children are long-running programs in the Philippines. Further, institutionalized through RA 11037. An important feature of PPAN 2017 to 2022 is the call for more dietary supplementation programs for pregnant women and children 6 to 23 months old, even before they become malnourished. This is the reason why the National Nutrition Council, together with the Office of the Cabinet Secretary, Carlo Alexi Nograles, launched the Tutok Kainan Supplementation Program. Tutok Kainan is NNC's COVID-19 response and has been implemented and will be implemented to monitor and evaluate an integrated nutrition program that helps ensure delivery of complementary early childhood care and development services in the first 1,000 days pursuant to RA 11148 or the Kalusugan at Nutrisyon na Magnanay Act. Tutok Kainan's objective is to contribute to the prevention of stunting among children 0 to 23 months old by improving the quality and quantity of food and nutrient intakes and utilization of related ECCD F1K services among the nutritionally at-risk pregnant women and children 6 to 23 months old in the targeted Tutok Kainan program areas. It aims to provide additional food to pregnant women for 90 calendar days and complementary food for children 6 to 23 months old for 180 calendar days with priority to those who are nutritionally at risk or undernourished. The project components of the Tutok Kainan Supplementation Program include the following. 1. Social preparation activities. This includes master listing, signing of memorandum of understanding with local government units, LGUs, signing of memorandum of understanding and marketing agreements with the Regional Department of Agrarian Reform or the DAR and the Agrarian Reform Beneficiary Organizations, and orientation to local chief executives as well as health workers and beneficiaries at the LGU level. Second, dietary supplementation. This program involves giving supplementary food to pregnant women for 90 days during their last trimester of pregnancy and to 6 to 23 months old children for 6 months. Third, maternal nutrition education. Implementation of this program is complemented by text blasting of nutrition text messages and mothers' classes using the Idol Ko Si Nanay learning module in the first 1,000 days, which will also be conducted in some areas, subject to quarantine restrictions. The said module will guide the mother participants to examine their existing feeding and caring behaviors for them to identify which of these practices can be retained, improved, or changed. The other component is a community home food production. In coordination with the local agriculture offices, the program shall provide families with access to services and commodities for the establishment of community or home food gardens as ready and steady source of nutritious foods for the pregnant and their children and their babies. Fifth, short messaging system reporting or text messaging. Local health workers report real-time accomplishments through SMS messaging that are sent to the Tutok Kainan reporting system. The food items for Tutok Kainan will be procured from mixed sources with preference for FNRI technology adapters when available, or other nutritious food formulations served in combination with local available food. For the pregnant women, Nutriban will be used for the first month and will be partnered with a lipid-based nutrient supplement in small quantity or LMS SQ in the last month. They will be distributed with iron fortified rice and viand in the second month. For the preparation of meals, ingredients and fresh produce shall be procured preferably from agrarian reform beneficiaries organizations and small farmers groups at the LGU level. These fresh food items shall be used to prepare healthy recipes for the pregnant women and children 6 to 23 months old, consistent with the NNC-approved cycle menu for the program. Tutok Kainan Supplementation Program has actually four phases based on budget allocation. Phase 1 is actually ongoing, which provides dietary supplementation for pregnant women in 7 Human Development Poverty Reduction Cluster provinces, 1 city, and selected LGUs in NCR, and provinces affected by typhoons Ronnie and Ulysses in 2020. Phases 2 and 3 will be for supplemental complementary feeding for stunted and wasted 6 to 23 months old children, and phase 4 again for pregnant women. As mentioned, phase 1 of the dietary supplementation program in areas is ongoing in 62 LGUs, which covers 9,158 pregnant women. For emergency areas, social preparations are ongoing, and we are finalizing the procurement of commodities. Phase 1 in emergency areas will start on the 4th week of May. Now, for phase 2, social preparations and procurement are also ongoing, and this will start in June. Infant and Young Child Feeding, or IYCF, refers to the advocacy, protection, and support of safe and optimal feeding for infants and young children. This includes promotion and protection of breastfeeding and protection of non-breastfed infants by minimizing the risk of artificial feeding and practicing appropriate complementary feeding. Results of the 2019 Expanded National Nutrition Survey of DOST FNRI revealed that we were able to exceed our target for exclusive breastfeeding at 35.1%. Regrettably, we are way below our target for 6 to 23 months old, meeting the minimum acceptable diet or minimum diet diversity and meal frequency, as discussed before by the Dr. Actepa. The IYCF program aims to improve the practice of exclusive breastfeeding and complementary feeding by building and sustaining an enabling environment in various settings. Hence, IYCF continues to focus on the following key strategies for 2021 to 2022. One is on health system support, which targets increasing the number of hospitals accredited as mother-baby friendly and with trained personnel on the care of small babies. Second is on community-based health and nutrition support, which targets increasing the number of nutrition counselors trained on complementary feeding and relief feeding. Setting up of more functional human milk banks, and third, increasing the number of municipalities in PPAN-focused provinces with established pool of trained mother support groups and peer counselors on IYCF. And lastly, increasing the number of barangays with functional community-based support groups on IYCF. The third strategy is on maternal protection and improving capacities of workplaces on breastfeeding. This particular strategy aims at all regional tripartite industrial peace councils adopt a resolution advocating or in support of the breastfeeding and lactation policy, and that all NNC governing board member agencies implement the civil service DOLE issuance on RA 10028 or the Expanded Breastfeeding Promotion Act of 2019. Another strategy is the enforcement of the Executive Order number 51 or the Milk Code through the Regional Interagency Task Forces EO 51 and RA 10028. And lastly, for 2021 to 2022, the DOH will be conducting essential maternal newborn care and lactation management, national training of trainers, harmonized maternal newborn, child health and nutrition training, mother-baby friendly hospital initiative assessors training, and milk code task force training. Another nutrition-specific program for under 5 children is micronutrient supplementation, and it is the provision of pharmaceutically prepared vitamins and minerals such as vitamin A, iron folic acid, zinc, and micronutrient powder for treatment or prevention of specific micronutrient deficiencies to complement sustainable food-based approaches. This program focuses on pregnant and lactating women and children ages 6 to 59 months, as these are the groups most vulnerable to micronutrient deficiencies and their consequences. Our target by 2022 is to reduce the micronutrient deficiencies of children under 5 years old to levels below public health significance. However, based on the results of the expanded National Nutrition Survey of DOST FNRI, both vitamin A deficiency and anemia remain a moderate public health concern among 6 months to 5 years old children based on the WHO cutoff points. All right. Now, on the provision of vitamin A capsules and micronutrient powder, we are targeting to reach at least 90% of the children 6 to 59 months old. But based on the field health service information system and field reports from DOH in 2019, we were able to meet only the target for vitamin A supplementation of 6 to 11 months old. And the last nutrition-specific program is the Philippine Integrated Management of Acute Malnutrition, or PPAN, which is recognized by UNICEF and WHO as the only established evidence-based intervention which successfully addresses the problem of acute malnutrition. It involves capacity building to local implementers and provision of services to acute malnutrition, or the SAM and the MAM cases, both under routine health program and during emergencies. Another pillar of the PPAN is what we call the nutrition-sensitive programs. And these are programs that are tweaked or modified to deliver positive nutrition outcomes. Now, to ensure that we address malnutrition in a sustainable manner, we capacitate people, not just giving them fish, but teaching them how to fish. So we have identified ways by which some sectoral programs from agriculture, social protection, education, trade, and health can be further tweaked to help people provide better nutrition for their family members. And the third and the last pillar is on LGU mobilization, or the local government unit mobilization, highlighting the key actions to strengthen the local nutrition committee's functionality and effectiveness. In 2018 to 2019, before the COVID-19 pandemic, the National Nutrition Council conducted various planning workshops in the 36 PPAN-focused provinces, capacitating them to incorporate in their local nutrition action plans, the PPAN programs, and annual investment plans in their budgets. To date, approximately 200 million pesos has been generated to finance the PPAN programs in their respective LGUs. Before I end this presentation, let me read this statement from the Global Nutrition Reports and the World Bank Group. Malnutrition is a threat multiplier. If no action is taken, the effects of the current COVID-19 pandemic will only make it harder for vulnerable populations to protect themselves against malnutrition. This is the reason why we must continue to work together, where even short-term disruptions could have irreversible effects on child survival, health and development, and long-term productivity. Being a multifaceted problem, malnutrition requires that we unify our public and private plans and efforts and use integrative and coherent approaches to solve this problem. May each one of us serve as angels in giving the best protection to our children, shielding them from hunger and malnutrition. That ends my presentation. Thank you very much, and may God bless us all.